want to know that he's here. So he usually uses opportunities to talk about things that he feels is important for people to know about certain type of illnesses that are responsible for much deaths, sometimes premature, and diabetes and high blood pressure and those kind of stuff are some of them. So we have him taking some time out of his daily schedule while he's on the island to talk to us for the remaining minutes. So let me shut up and ask him to get in here. Good afternoon to you, Honorable Priest.
Yes, my brother, give thanks for life and a mighty life giver. Give thanks for having me today.
You've been talking about all kinds of stuff, but now I believe it's time for you to talk about something today, and I don't know what it is. I can't follow you.
Well, definitely, we there until tomorrow evening. Probably might stay until Saturday morning, but for now, our timeline is a 3 days here in St. Martin to actually continue the work that we began when we came previously. And today, even before we go further, I would like to touch on certain issues that are very important, especially when it comes to human's health. Because for the past couple of days, even for the time that I have been here, I have seen at least 2 or 3 different people, specifically, I think 3 people, 3 clients, 3 females, who have been the same thing I mentioned yesterday when it comes to the whole aspect of hormonal imbalance, when it comes to the whole aspect of the fertility of the woman and the whole aspect of libido that woman having that desire just to actually come together with a husband. And this is something that people might take simple, but as I said, in St. Lucia, I was on Wednesday, now on Tuesday in our clinic. I had at least 2 or 3 women, the same day in the morning, early in the morning, who came in and says, well, priest, I have been with someone for 20 years and I don't know what it is like to experience an orgasm, and then the sex drive is very low and so on and so on. And then the other woman that came was the same story. That's immediately one after the other. And then afterwards, maybe about 2 or 3 patients down the line, there was another woman who was complaining about not having that capacity to have that desire to actually come together with a husband. And the second couple I had a consultation with when I was there, when I asked this time around, right, that was yesterday, right, it's the same issue, whereby, yes, infertility, but also that incapacity to actually have that desire to actually come together.
Can I ask you if that can be a mind thing?
Well, it can be a mind thing, because at the end of the day, the mind actually controls what hormones is in your physical structure. So basically, the mental state could affect it, because based upon how stressed you are as a person, that could determine whatever hormones is actually flowing throughout your physical structure. So if a dog is chasing you, you won't be thinking about having sex. You'll see 100 naked women there, and you just run right past, because somebody is chasing you for a gun or a hurricane coming. You won't get an erection. Right, so that means that your body is operating in the flight or fight state, adrenaline kicking, no epinephrine, so you're not really interested in that, because the focus is not on that because of your high cortisol levels. So intense stress, yes, through the mind, definitely that could actually have a serious...
So stress play a role in this too as well?
Yeah, well, stress, as we have noticed over the years, especially when it comes to the whole aspect of the overall health of both man and woman. You see, like if I'm with the man, a man who've actually been rejected a lot, like a man who has gone through rejection, over a period of time, it is very likely that he develops prostatic problems, just because of that rejection. When a man is rejected, it's not a nice thing, So it actually cuts down his whole testosterone levels, right?
Tell me about it.
And testosterone levels is what actually gives a man an erection. Right, so when you actually talk about the whole aspect of testosterone because of rejection, so that's why, okay, so they'll tell a man, boy, you have too much testosterone, man, cool out yourself. That's when you feel macho and thing. Yeah. But when the man does not feel macho, and his testosterone levels actually decrease and his female hormone actually increase, then what you have is that he goes through that whole aspect of poor libido, erectile dysfunction, and he could hardly have an erection, because testosterone in the man is the hormone that actually stimulates the diversion of the blood to the penis. Because as many times before, we've asked the question, what is the bone in the penis? And there is no bone in the penis. The whole erection phenomena is basically based upon a direct a redirecting of blood flow to the penis by the increase of what you call testosterone, the male hormone, and also a chemical called nitric oxide that dilates the vessels. And then as the blood flows to the penis, there is like a one-way valve that prevents the blood from coming out. So this man actually remains erect, right, to actually perform the sexual act. So same thing with the woman. The woman also have what you call erectile tissue, and that erectile tissue is the breast. The breast contains erectile tissue, and also the outer part of the human vagina, which is basically the labia minor and the labia minor, which is basically what they'll call the lips in common day English. And also the clitoris of the woman is made up of the same type of tissue as the penis of the man. It contains erectile tissue. So the clitoris also has the capacity to actually get erect, right? And but for the woman, the hormone that actually takes charge of that specifically is the female hormone called estrogen. And estrogen is the hormone that actually boosts up a woman's libido. So when you hear that people are complaining, a woman are complaining, that man, their husband complaining because he feels like as if it's something that he is doing wrong, and I mean they could go for 45 minutes and nothing, and she never feels for it. It's basically because you have that problem of hormonal imbalance. And just like the man would want to resolve these issues, the woman needs to resolve these issues, because all of us know that sexual intercourse or coming together is something that is divine, something that is wholesome. That is how life is actually perpetuated. I mean, the moment that sexual intercourse stops, that's it. Life is done, because it's through sexual intercourse you came about, I came about. Everyone in the world actually came about through sexual intercourse. Even Adam in the Bible had an umbilical, had a navel, right? If he had a navel, he had a navel string. That means that he came from a woman also. So it is very important that we actually understand that, and as a woman and as a man in relationships, that we try our best to see how we could nurture our hormones and balance our hormones completely.
But isn't that diminishes or get less and less active as you get older?
Well, as a man gets older, his testosterone levels naturally begins to shrink. That's or go down. That's why he gets bald, because he loses hair because of the decreasing of testosterone. And also, but with the man, his estrogen levels actually increase. That's why his prostate naturally enlarges as he grows older. The woman, as she grows older, her estrogen level actually decreases. That's why she goes on men on pause. So they say she pauses on man. And then that is why now, as the estrogen levels actually decrease, if this woman is suffering from fibroids, right, the fibroids will naturally shrink and become a dry mass or a calcified mass, just because of the decrease of estrogen. So yes, the libido or the feeling to actually come together would decrease in a woman, and also the level of lubrication would actually decrease, just because of that decrease of estrogen, because all these are actually stimulated by hormones, by chemicals that actually traverses through the bloodstream of that man and that woman.
So you actually can remedy this, or you tell them what to do, or you have medication to help people to at least maintain it for a little bit longer?
Well, what we do is that, because I mean we've been known over the years to specifically be very good when it comes to the whole aspect of fertility. So fertility, we have a natural fertility clinic. So fertility is something that we pride ourselves on, that is to actually help people who cannot conceive to conceive. And even in St. Martin, we have plenty of babies that people we have assisted. In Anguilla, plenty, right? Dominica is the most prolific. St. Lucia, England, the States, the worldwide. Plenty of people have actually gone through our programs, our regime, to actually boost up their fertility rate. And what we do is that we don't actually see the fibroids or the polycystic ovarian syndrome as the disease. We see the hormonal imbalance. So what we do now, we actually work with them to actually help to balance the hormones. So we say, well, 70% of balancing hormones come from being able to actually deal with your stress and help to manage your stress, and the rest of that comes through the herbs that we actually give to them. So for the man, we have a male package. All right, so the male package for the man would consist of the free up laxative, which basically is a colon cleanse, because health begins in the colon. You have to cleanse your colon. I was speaking to a brother yesterday from Guyana, and he said, "Boy, priest, you know that our parents used to actually wash us out or give us a flush out every 3 months, and then His wife was like, wow, I mean, that's often, but that's the culture that we actually was raised up in. So the male package contains 7 bottles specifically. So this contains a free up laxative to clean out the colon, so you flush it out, and understanding that also that the prostate is very close to your rectum. That's why when you go to the doctor, you have a bimanual examination of the prostate. They make you stoop down, and then they push their finger into the anus and press down towards the testicles to touch the prostate. So the prostate is extremely close to the rectum. So when you are constipated, that could actually cause an inflammatory change within your prostate. Even a man that has actually hemorrhoids or piles, which is like a varicose veins inside of that sphincter muscles right through the anus of the man, this could actually put pressure upon the prostate and develop prostatic problems. His PSA could actually go up, not because he has prostate cancer, but because of inflammatory changes. Because PSA just means prostate specific or prostate specific antibodies. That means that your immune system is producing an antibody, which is basically an immune system molecule that is specifically related to inflammatory change within the prostate. That means that your immune system is saying, well, look, there are some things we need to actually fix up in the prostate specifically. So with the woman, it's about the same thing, right? So when we deal with the woman's health now, we are talking about how is it you're going to balance the hormones for that woman. So if the man, we clean the colon, we detoxify the blood. So blood detoxification means that we clean in the blood, we clean in the liver, we clean in the kidneys, we clean in every organ of the physical structure to detoxify and cleanse it. And then we have hormonal balancing. So for the man, you have the important male tonic that deals with making the impotent more important, right? It actually helps to balance off the hormones of the man. And then you have the pure green to help to boost up the alkalinity of the blood, because the more alkaline your blood is, the better for you, the more your system actually functions properly. So a man with diabetes, for instance, his blood sugar levels would be high. So that means that his blood would have a higher level of sugar than the sugar intracellularly. That's the sugar in the cells. So even if there is sugar outside of the studio and it's not in the studio, you have no access to it because it's outside. So the same way, even if the sugar is in the blood but out of the cell has no access to it. So what happens is that because of that increased level of extracellular glucose or glucose in the blood, it gets the blood very acidic. And because the blood is acidic, it actually damages your blood vessels and also damages the nerves. So you develop what you call vascular changes and also diabetic neuropathy, which leads to erectile dysfunction in the long run and no erection at all when it comes in the future. And then you have the pure green, then you have the garlic syrup, or you have what they call the guinea hen weed, or what they call the anamu, or what they call the kojo root. That is basically one of the products that's very effective in regulating the blood consistency, very rich in sulfur and sulforaphanes. So it helps to take out excessive estrogen from the physical structure, and it's also an aphrodisiac. That's why they call it feuille du vent, right, in Creole or in French, because it actually makes the man go forward or better. And then finally for the man, you have the pure gold, which basically is responsible for boosting up his circulatory system and also removing mucus from his physical structure. And the final product within the 7th packet is the prosperity. The prosperity is the one I'd give you the last time, right? Yeah, but you remember that one? You don't remember that one?
What do you want me to tell you?
You don't tell me anything. I'm just telling you that the prosperity is the small bottle I had given you the last time. That's excellent for prostatic health and is a very good aphrodisiac to help a man to actually function better. Right? And I'm not saying that you needed it, right? Because I don't drink it just because I need it. You don't have to wait to get sick to actually drink them things there, You could drink it just to maintain good health.
How do we lead ourselves to get into such a state? What do we do? Is it what we eat or how we neglect checking up on these things? What do we do?
Well, people actively work towards getting themselves sick. The majority of the food on the shelf is dead. All the food on the shelf is dead, man. If you take rice and you plant it, it don't grow. If you take flour, you plant it, it don't grow. If you take spaghetti, you plant it, it don't grow. If you take a piece of chicken and you throw it in the ground, it don't grow. Right? Most of these things, they are dead, so they have no life essence. They don't have the capacity to actually nourish the physical structure. That's why it is as a rule of thumb to actually ensure that the foods that you consume are fresh. Right? So if you take, for instance, quinoa or amaranth or millet, right? Or wild rice, the black one, if you soak them, they sprout. right? They begin to grow. So these grains are more wholesome and holistic grains. So if every day you're eating cheese and milk and rice and spaghetti and macaroni and cheese and all them, you are actually continuously and consistently working towards destroying yourself. So with the meal package, we also provide a guideline. That means that we give you a dietary guideline, because the same way that you could actually destroy yourself by consistently eating bad, you could build back your physical structure by consistently eating healthy. So with the human, we have the human package. The human package also contains the colon cleanse, to cleanse out the colons, because health begins in the colonic walls. So you have to clean out the colons. That means that you take something, you drink the entire bottle. It contains ginger, neem, senna, castor, olive oil, coconut oil, to and also sea moss, to lubricate your intestines and also to increase the peristaltic action. That means it makes your intestines contract more, so it removes that thick plaque layer that's against the walls of your colon. So this flushes you out aggressively, right? Joanne is not here today, but I would have asked her how did her laxative do with her, because that's things that you actually have to take every 3 months. You flush out your physical structure, right? So then after the laxative, after you flushed out the colon as a human, then you come to the blood. Cleanse out the blood, detoxify the blood, detoxify your liver, and cleanse out the liver. Now, because the liver it contains 80% of the blood flow, right? When you are going through a normal metabolic functions, that means that a congested liver will result in a human having signs of anemia, because the majority of the blood will actually stick into the liver. So decongesting of the liver is very important to guarantee good health in the human, especially. It makes more of the iron available to her. So the blood detox and the cellular detox is specifically for that. Then you have the womb cleanser and the hormone balancer. So the womb cleanser and the hormone balancer is basically specifically designed so that the woman could at least cleanse out the womb, increase the contraction of the womb by increasing the level of estrogen or regulating it, and decreasing the level of progesterone, because the majority of our women with polycystic ovarian syndrome, what they call PCOS, is because of progesterone and estrogen dominance, excessive of both of these hormones. And then you have fibroids, is caused because of estrogen dominance that cause that tumor to grow in the breast. So the same way that tumor can grow in the breast, or the tumor can actually grow in the womb, they call it, or you have fibrocystic breast changes because of that increase in the ductal proliferation because of an increase in progesterone. The same way that you could actually reverse it by regulating your hormonal balance. So the womb cleanser is what we give to the woman. Even if you're on menopause or you pause on man, as they would say, you get a female package. It helps to bring back your libido. It makes you feel like, yes, you could do it again. Okay?
This menopause, what does it really mean?
Well, it means that you've had significant decline of estrogen. So it means that your whole metabolic rate is gone haywire. You feel hot, you feel sweaty, the vaginal canal, the glands, they don't produce any more oils to actually lubricate it. So sexual intercourse becomes more like a nuisance because you don't have that lubrication. Then also the libido is decreased. You don't feel like it anymore. The menstrual cycle stops. You understand that? So all these things that naturally happen when you pause on man, or what they call menopause, right? But with a lot of women suffer from premature menopause. Some women get with the menopause from 40, 45, 46, and yet still that's abnormal. And yet still you have women that actually goes into menopause at the age of 60 something, right? So I know I met somebody that's at 66 as I came in, and they still having their menstrual flow, right?
Wow.
So yeah. So it is not that your menstrual flow is something that's unhealthy, as long as it is something that is done and you are not feeling dis-ease. So the woman, you have the laxative, you have the blood detox, you have the womb cleanser and the hormonal balancer, then you have the blood regulator, that's the animal syrup, then you have the pure green to build back up the iron, you have the pure gold to work on the circulation and to remove the mucus, and then you have the product called the answer. Now the answer is basically the answer. Plenty of women have, our previous time here, we met clients who have been bleeding for 8 months, non-stop, and they have been hemorrhaging for 8 months because of hormonal imbalances, right? So the answer has the capacity to actually calm down that bleeding. For some people, it stop it completely, right? But it is something that you have to be on. If it's a severe case, it's something that you have to be on for at least 2 to 3 months consistently to help to actually curb that excessive bleeding completely.
How can they find you?
Well, basically, I mean, right now, for the rest of the day, we'll be at Paradise Inn. That is right at the back of WIB Bank. That's right next to Costules. We'll be there from 2 o'clock until evening time. Actually, is to see people. So who want to come and see us, definitely they could actually come to see us. And the people who want our number, I think the number is 559-3580. That is 559. That's the right number.
Yes, sir.
You sure about that?
You got it right.
Yeah, 559
You should know it better than I
3580.
do.
Now what I mean, you know that sometimes it's not everything that I know. Sometimes
just so
you
happened-
yourself
It just
you
so
are,
happened